I'm delighted to be here representing the board and representing our volunteers all across the country. We have 300 plus affiliates who make up really the heart of our organization. We have a fabulous board and an incredible staff, and so it's just a delight and a privilege for me to have the good fortune to serve as chair during two momentous events, one the Passage of Parity and now the celebration of our 100th anniversary. So on behalf of all those who couldn't be here today from our board and affiliate community, let me thank all of you for being here and for sharing with us on this day. You know, we passed parity, and it was such a huge deal, and I think we all heaved a great sigh of relief that it had passed. And then I think probably all of us here realized, oh, there's still a lot of work to do to actually implement parity. So it's got to have the same urgency now as it did when we were trying to get the bill passed. That was just like step one. There's so much vital work for us to do as we begin our second century. The research that Richard talked about, the crisis right now of our returning veterans, just the fact that we still don't have an expectation that people with mental and substance use conditions are going to get the same quality of care as people with other health conditions. It's not really acceptable. And we are certainly, as many of you, pushing this notion of mental health as integral to overall health. And we think it's important for all Americans to have mental wellness, not just the absence of symptoms, not just the absence or reduction of illness, but actually a full and productive life. So our message is simple. Mental health is fundamental to the health and well-being of every person in the country. As David said, it's time for mental health.